Hello viewers, my name is Dr. Sanen, and I'm a dental surgeon by profession. Today I'm going to talk a little bit on substance abuse from a dentist's point of view. Now first of all, when it comes to substance abuse, the serious, first it is the substance abuse, next comes the dependence or addiction, third comes tolerance, fourth, finally, there's withdrawal. So let's try to understand what happens in each of the following steps. Substance abuse in this step. It is the recurrent use of a substance over the past 12 months by a person or by an individual with subsequent adverse effects. Now, after this stage comes addiction or dependence. It is when a person has uncontrollable need for use of a particular substance despite knowing its adverse consequences. Now, under the addiction, we have two sub-steps. First is tolerance, second is withdrawal. Tolerance, as the person continues to use or as the person's addiction grows, there is increased demand for that particular substance in order to achieve the desired effect. And as the person tries to withdraw from such addiction, there are groups of symptoms or signs which the person might show from abstinence of a particular substance addiction. Now let's understand who are the individuals who indulges in such substance abuse. Firstly, let's all understand that 8.7% of the total population indulges in substance abuse in any form. It is more common in males, mostly seen in males than in females, and is seen between the age of 18 to 25 years. It doesn't mean that this is the only age group in which substance abuse is noticed, but it can be in any ages, in any stages of life. Now, what mainly happens in substance abuse is it disrupts your dopamine circuits in your brain. As we all know that dopamine, it is the feel-good neurotransmitter in our body. Now, in a dental clinic, when patient comes, the common substance abusers we usually notice are those who use tobacco, those who smoke, and those who indulges in alcohols. I want to stress a little bit on tobacco abuse, as it is commonly seen and easily available, and is easily misused. So let's understand a little bit on tobacco addiction. What is tobacco addiction? When people are addicted, they have a compulsive need to seek and use a particular substance, even when they understand the harm it can cause to oneself. It can be in any form, such as cigarettes, cigars or pipes, and smokeless tobacco. It can all lead to addiction. Now, everyone knows that smoking is bad for you. And most people that do it, they want to quit. Nearly 35 million people make a serious attempt to quit each year. Unfortunately, most try to quit on their own relapse, often within a week, due to improper guidance. Now, let's understand a little bit on tobacco use and its ill effects on our body. Recent research shows that the dangers of smokeless tobacco may go beyond the mouth. Smokeless tobacco contains more nicotine than cigarettes. Nicotine is highly addictive drug. And let's know that nicotine is not the only substance, only chemical present in tobacco. It is just one out of 3,000 substances present in tobacco. Now, some of the ill effects of tobacco, smokeless tobacco, it will lead to mouth, tongue, and throat cancer. Cancer in the esophagus. As we can understand, esophagus, it is the swallowing tube which goes from your mouth to your stomach. Stomach cancer, it can lead to pancreatic cancer. And it also has a history of heart diseases, heart attacks, and stroke. We have commonly seen white patches in our mouth, also known as leukoplakia, which if not cured in time, can lead to cancer. Tobacco abuse can also cause receding gums. In this case, in this situation, your gum line recedes below its normal height, thus resulting in loosening of your tooth. It can cause bone loss around the roots of your tooth. It can cause abrasion, which is known as scratching and wearing down of your tooth, and finally lead to tooth loss. It can also lead to bad breath and discoloration of tooth. Talking about tobacco abuse, it has so many ill effects in our oral cavity and our dental health. And finally, it can lead to oral cancer. Now, according to WHO, the tobacco epidemic kills up to half of its users and contributes to more than 8 million people dying every year. The Global Youth Tobacco Survey carried out in Nagaland among 1,919 students, 13 to 15 years of age, in 2019 showed that 35% of students use smokeless tobacco. In average, it shows that out of this number of students, 600 to 700 students indulges in smokeless tobacco. Why? It's because of its easily availability and improper guidance. Now such patients present in a dental clinic in various cases. Some of them are bleeding from gums, staining of tooth, and swelling of gums. Out of every 10 patients have tobacco-related problems. It generally takes 10 years or more for lesion to develop, but is now seen in 16 to 17 years old these days due to the early use of tobacco. Oral cancer will develop if the lesion grows and the person continues to smoke. Many individuals between the age of 30 have third or fourth stage lesions, which are primarily caused by tobacco use. The issue is that small lesions do not cause much discomfort to the individual, but when they grow into full-grown cancerous lesion, they become extremely life-threatening. Now let's talk a little bit on oral cancer. Oral cancer, it can be said as an uncontrolled growth of cells that invade and cause damage to your surrounding tissues. They can occur anywhere in your oral cavity. Now, the most common form of oral cancer is oral submucous fibrosis. So, it is a medical term. So, in simple terms, it is a precancerous lesion, and it has a chance to transform into a malignant tumor in about 1.5 to 15% of all cases. Symptoms or the signs which a person suffering from a precancerous lesion shows: ulceration in the mouth, xerostomia, which is also called as dryness of mouth, a burning sensation in that particular area, and restricted mouth opening. The person is unable to open his mouth. Let's talk a little bit on the stages of oral cancer. Now, oral cancer has 4 stages. Stage 1, it is the early stage of an oral cancer, and it can be seen as a small, minute lesion or spots in your mouth, less than 2 centimeters in size, and it has not spread to your lymph nodes. Now let's understand a little bit on lymph nodes. Lymph nodes are present all over your body, and this contains white blood cells which help in fighting infections in your body. Now in stage 2, it appears as a tumor in your oral cavity, in your mouth, and the size is greater than 2 centimeters and less than 4 centimeters. And also in this stage, it has not spread to your lymph nodes. Now in the third stage, the tumor size is greater than 4 centimeters and it may have spread to your lymph nodes. Now in this stage, you should be careful. It is just next to the last stage of an oral cancer. In the last stage, the stage 4, it is the advanced stage of oral cancer, and in this stage, the lesion or the infection in your mouth can be of any size, and it has not just spread to your lymph nodes but also spread to other regions of your body. Okay, let's talk a little bit on the types of oral cancers. Now, oral cancers can be seen as a lip cancer, it can be seen as a gum cancer, it can be seen as tongue cancer, and it can be seen as a cheek cancer. Inner cheek cancer, which is very common in tobacco users, as it causes stiffening of your cheeks and leads to restricted mouth opening, in which case the person is unable to open his mouth. Now, it can also be seen as a floor of the mouth cancer, which can be seen under your tongue. Now let's talk a little bit on those persons who indulges in substance abuse. Now, it is seen that 8.7% of the population indulges in substance abuse. It can be in any form. And in a dental clinic, the person shows substance abuse in the form of tobacco, alcohol, and smoking. And it is also seen that it is more common in males than in females, and also in the age group between 18 to 25 years of age. Now, it is mentioned as 18 to 25 years, but it doesn't mean that only this age group indulges in such substance abuse. It can be of any age, in any stages of life. Now, another form of substance abuse seen in a dental clinic can be alcohol users. Now, such patients, they present problems such as dental caries and bleeding from gums. Now, what happens in this case is, when a person consumes alcohol, it contains acids which mixes with the germs in the mouth, and these acids reacts with your tooth and then causes cavity. Now, in smokers, the most common signs of a smoker is a smoker's palate, in which there is browning or brownish discoloration in your tongue as well as in your roof of the mouth. So as we have discussed about oral cancers, it is an irreversible disease and it cannot be cured permanently. So I advise our viewers, in conclusion, to abstain from the use of tobacco in any form, be it smoke or smokeless tobacco, and lead a healthy lifestyle.